Welcome to our tutorial on distal limb joint assessment in horses. In this video, we will explore the risk factors for abnormal joint motion and discuss subjective and objective ways to assess the quality and quantity of joint motion. Distal limb joint motion in the horse is considered abnormal if either hypo or hypermobile. Causes of restricted motion include, but are not limited to, osteoarthritis, joint capsule contracture, usually secondary to prolonged immobilization, and flexor or extensor tendon contracture. Increased range of motion is usually due to compromised supporting tissues. For example, suspensory apparatus dysfunction, flexor tendon lacerations, or fractures. As such, a systemic assessment of distal limb range of motion is an important preliminary step in the clinical examination of orthopedic cases, as it aids the clinician in identifying areas of concern and establishing a baseline for range of motion and thus determining the response to treatment. In order to identify abnormal motion, the clinician must first know the normal joint range of motion for the distal limb. Subjectively, for the carpus, horses should be able to flex the joint to have the palmar metacarpus complete contact with the caudal forearm. In extension, the carpus should not extend past 180 degrees. For the metacarpal phalangeal joint, normal horses should be able to flex to touch the hoof to the point of the elbow. In extension, the metacarpal phalangeal joint should not extend past about 45 degrees. Individual hind limb conformation does not allow for similar guidelines for the tarsus and metatarsophalangeal joint. Due to the reciprocal apparatus, the hind limb is much more difficult to assess each joint in isolation. While these represent basic guidelines for the subjective evaluation of joint range of motion, goniometry represents a more objective technique for its quantification, which is beneficial from both a baseline clinical assessment and response to treatment or intervention. Typically, the horse is restrained by one individual. Another individual performs the joint motion, guiding the joint through the desired motion until the endpoint is reached, and the third applies the goniometer to the limb. Usually, 3 replicate measurements of the joint in question are taken in full flexion and extension. The average of the 3 measurements should then be recorded. Adair et al. Reported that goniometric flexion and extension measurements from normal horses have a high correlation to radiographic measurements in both flexion and extension for the carpus, tarsus, and metacarpo and metatarsophalangeal joints. In clinical cases where there is concern for mild to moderate abnormality, the contralateral limb should be used for comparison. Again, typically, goniometry in horses requires 2 to 3 people. First, it is often helpful to record a standing or static position to assess changes in standing joint posture over time. Then, with the horse restrained, one individual will manipulate the joint, another individual will place the fulcrum of the goniometer at the center of rotation of the joint, and the arms are aligned in parallel to the proximal and distal bone segments. Measurements should be taken in full flexion and extension to determine the range of motion of the joint. Motion should not induce discomfort, but should be an accurate representation of the complete motion ability of that joint. When approaching the front fetlock, stand to the side of the forelimb facing caudally. Pick up the limb and support the leg with one hand on the pastern and one on the dorsal aspect of the carpus. While keeping the carpus stable, record full flexion and extension. When measuring the carpus, stand to the side of the forelimb facing caudally. Pick up the limb and support the leg with one hand on the dorsal metacarpus and one on the dorsal forearm. While keeping the fetlock, elbow, and shoulder neutral, record full flexion and extension. Regarding the hind fetlock, stand again to the side of the hind limb facing caudally. Pick up the limb with one hand on the pastern and one on the dorsal metatarsus. Try to keep the hock and stifle stable and record full flexion. Extension while non-weight bearing will be difficult due to the reciprocal apparatus, and likely would be more representative taken while standing. For the hock, again, stand to the side of the hind limb facing caudally, pick up the limb and place both hands under the toe of the hoof, pulling the toe forward. Try to keep the metatarsus parallel to the ground. Due again to the reciprocal apparatus, you will not be able to fully isolate the hock from the stifle, but you can restrict the fetlock flexion to some degree. Record full flexion in this position. Extension will be measured by allowing the tibia to rest on your leg with the fetlock relaxed. Slowly extend the entire limb and extend the hock with your hand or leg on the dorsal aspect of the fetlock. Again, the reciprocal apparatus will not allow you to fully isolate the hock from the stifle. During the mobilization, clinicians should evaluate several aspects of the joint motion. Joint end feel is the manual perception of the joint barrier. This can be described as soft, firm, hard, or empty. Soft end feel can be due to normal soft tissue approximation or fluid. Firm has a solid yet elastic end feel that can be normal or due to restrictive soft tissue. A hard end feel is typically when bone contact prevents further motion, such as with osteoarthritis or normal cuboidal bone anatomy. An empty end feel is always pathologic and results when a soft tissue spasm due to pain prevents the joint from going through full range of motion. In addition to the joint end feel, practitioners should also note signs of pain or withdrawal during the mobilization, periarticular heat or swelling, periarticular muscle spasm, or other guarding or avoidance behaviors. Caution should be taken performing passive range of motion as described here if there is concern for fracture, joint luxation, joint sepsis, or if the horse is unable to adequately and safely balance, as this becomes a safety concern for the individuals involved. In conclusion, subjective and objective assessment and documentation of distal limb joint motion in the horse is an easy and important aspect of the musculoskeletal exam.